What are the other prenatal lab tests? There are so many other prenatal laboratory tests which can be combined with this 11 to 14 weeks double marker aneuploidy screening test, or they may be performed at a later stage. Friends, here I would like to give you an example of mobile phones. There are so many models released by the same company in the same year, and there are different models with different value added features. Similarly, in prenatal lab tests, we have so many panels with value added tests. That means if we want to have more number of tests and comprehensive tests, then the cost of the prenatal panel may increase. Let me give you the example of prenatal mini panel test. This panel will consist of 5 tests. One is HbA1c, second is serum TSH. We have already discussed about these 2 tests. The third is CBC. Fourth is urine routine microscopy, and fifth is blood group. CBC, again there are 3 components: hemoglobin, total WBC count, and platelet count. Friends, in pregnancy, because of hemodilution, that is the plasma level or liquid level increase is more compared to solid level or RBC level, there is hemodilution, and therefore the normal hemoglobin level reduces by 1 to 2 gram% as a physiological change in pregnancy. So friends, WHO has defined anemia as hemoglobin below 11 grams% in pregnancy, and less than 8 grams% hemoglobin is set as a critical level or critical value for pregnancy. Second component in CBC is total WBC count. In pregnancy, the idea is to protect the pregnant lady from germs, from infections. Therefore, the total WBC count increases as a mechanism of protection. So, the upper level of the CBC total white cell count in non-pregnant ladies would be 11,000, whereas in pregnancy this level is reset to 15,000 per cubic millimeter, which is considered as normal, and during labor this level up to 25,000 per cubic millimeter is considered to be normal. So, when you read the report and interpret it, these physiological alterations in pregnancy are very important to keep in mind. The third component of CBC is platelet count. In pregnancy, the platelet count is reduced slightly. So, what in non-pregnancy state, the lower limit of platelet count is 1,50,000 per cubic millimeter. In pregnancy, this level is reset to 1 lakh per cubic millimeter platelet count, and the critical value is less than 70,000 per cubic millimeter is set as a critical value. The next is blood group. If the pregnant lady is Rh negative, we advise the husband's blood group. If the husband is Rh positive, then the case is managed separately and depending upon the findings. Then the next test is urine routine microscopy, which will include the dipstick tests, which will include protein, sugar, pus cells and nitrite. Protein for preeclampsia, sugar for diabetes, pus cells and nitrite for urinary tract infection. The next panel will be prenatal basic panel, which will consist of 13 tests. The above 5 tests which we have already discussed. In addition to them, there are 8 tests. 4 tests are HIV, HCV, HbSAg, VDRL or RPR. Before doing these tests, we must offer pre-test counseling, and if there is abnormality or positive test is detected, we must offer the management according to the findings. 3 more tests are BTC-TPT, that is bleeding time, clotting time, prothrombin time. These tests define or imply the bleeding and clotting disorders. If there is any abnormality detected, the case is separate depending upon those findings. The next is urine culture sensitivity. it is aimed to detect the asymptomatic urinary tract infections. And friends, UTI can have lot of complications to mother and the fetus, and therefore it is important to detect it and treat it according to the antibiotic sensitivity so that the complications are avoided. The next panel, friends, will be prenatal advanced panel, which consists of 17 tests. We already discussed 13 tests before, and additional 4 tests will be there. So which are these 4 tests? Hemoglobin electrophoresis, test for malaria, test for this cytology or pap smear, and test for rubella IgG. So hemoglobin electrophoresis is done by HPLC methods, and it is to detect the abnormal hemoglobins like thalassemia minor or sickle cell trait. If carrier state is detected, then one will advise the husband's similar test for the husband, and if the husband is also found to be a carrier, then the case is managed differently accordingly. Then the next test is rapid test for malaria. That's antigen kit tests are available, and thick or thin smear also may be performed, and this will depend more importantly for those areas where malaria is more rampant and geographically more significant. If the malaria is found to be positive, then the case is treated accordingly. The further test is pap smear or cytology. If there is abnormality detected, the case is managed on those lines. And the next test is rubella IgG. This test tells us whether the lady is already having immunity against rubella infection or not. In future, in addition to all these tests, in this prenatal panel may be included COVID-19 IgG and IgM as the routine tests. These may be in future, they may be included in these tests. Friends, what will be the relative cost of these different prenatal lab tests? If one considers early prenatal MUST test as X, the other tests may be 2x, 3x, 5x, 7x or 13x depending upon the panel we choose. Friends, one can have one's own protocol designed depending upon the local protocol, the availability of tests and the availability of finance. Now, suppose the lady comes to the doctor in the second trimester. Between 16 and 20 weeks, the important test to perform is quadruple marker blood test. This is again a screening test, and it is important for those especially who have missed or not done double marker tests in the first trimester. For them, this test may be suggested. If the test is screen positive or high risk case, then further definitive diagnostic invasive tests are recommended and pre-test counseling, post-test counseling is performed. If the lady presents to me in between the 24 and 28 weeks of pregnancy, I will recommend a test like CBC, urine dipstick, that is for protein, sugar, pus cells and nitrite, and some form of glucose challenge test, maybe DIPSI test or maybe post glucose blood sugar or maybe oral glucose tolerance test to detect gestational diabetes mellitus and to treat it whether by nutritional therapy or by tablets or by injection insulin, so as to control the blood sugar levels and normalize near normal outcome for pregnancy and fetus, mother and fetus to be the aim. Suppose a pregnant lady presents to me in the third trimester. What are the important tests that I will recommend her? Again, CBC, urine dipstick. Then in this particular case, I will recommend group B streptococcal vaginal culture, GBS we call it, and If the patient is having preeclampsia, the test to be recommended will be serum creatinine and serum uric acid. Suppose a lady presents before delivery, then she may be recommended to perform COVID-19 RT-PCR test depending upon the situation of the pandemic and the local protocol which is prevailing in your area. Friends, here I would like to say, knowing is not enough, we must apply. Willing is not enough, we must do. Friends, I will give a message: do the right test for the right indication at the correct time and let the patient be benefited to the maximum. This video is also available in Hindi language. Keep watching, keep learning, update your knowledge. Thank you. Hope to see you again very soon. Thank you.